Hey, Dr. Dave here. Nice to be with you. As always, still on depression. I spend a lot of time on it because it's so important in my world and the world of many Americans these days, unfortunately. This is number 5. All right, talked last time about we're no better at treating depression than we were a long time ago, and that's because we do a one-size-fits-all to what in essence is 227 different types of symptom clusters. All right, back to then that melancholic depression we used to call it can't sleep, can't eat, can't sit still, weeping and wailing, doom, despair, and agony on me, take my Lord, I'd be better off dead, hide, anxiety, OCD, panic, low serotonin, low GABA, mixed neurotransmitter tone, usually high cortisol. Okay, temporarily, they might get an SSRI, selective serotonin reuptake inhibitor, Prozac, Paxil, Zoloft, Luvox, Lexapro, Celexa. Okay, you get the picture. I can talk about all of them because they're now generic and I'm not contractually beholden unto them. Or I might temporarily do an SNRI, a selective serotonin norepinephrine reuptake inhibitor. Same thing. It's a lateral move, right? Those are your Effexors, Pristiques, and Cymbaltas of the world. And I don't use those very much anymore, especially the farther away I get from that pure type of depression. Most of the depression I see is the other type, the atypical, the flat line, sleeping all the time, eating all the time, fatigue, brain fog, lethargy. They will not respond to those old SSRIs or SNRIs, so I do not use them. I'll use some newer fangled medications, the multimodal medications and SSRI plus direct receptor site modulators. Can't mention their names because, well, I am contractually beholden unto them. But there are 3 newer ones that I use, and then there's a new, brand spanking new NMDA receptor active agent, first new mechanism we've had in 60 years plus in terms of treating depression. So that's the medication piece of it. Now keep in mind, when the antidepressant doesn't work, which is often the case 2/3 at least of the time, what do? Well, there are 4, soon to be 5 medications approved to be added adjunctively to that antidepressant when it has stopped working. I shan't mention them either, but those would be the mood stabilizing atypical antipsychotics. I do that all the time. So I do all of that stuff depending on what kind of depression you have. Remember, I believe in personalized treatment for the most personal of all illnesses. As you know by now, I hope, I also do a lot of lifestyle medicine and a lot of nutritional supplementation, including for people who have symptoms of depression. I can't say those things treat depression, and yet I treat the symptoms of depression all the time. Naturally, more on that to come. You'll have to wait, right? All right, until then, peace out. We'll talk soon.